Okay, good afternoon, everyone. I'm Ron Dates, Blazing Star, Birmingham Promise advisor here at the VMAS, and this is our 8th annual Majors Fair. We have had a pretty good Majors Fair so far. Hey, thanks for all the participation we have been getting. I have been in some really great sessions, and you all have been asking a lot of great questions. So thank you all for your participation. Today is a very special one, I think. The School of Public Health, we have Nicole Gravitt here. Public health has been a hot topic for the last 3 to 4 years, okay? So this is something you all should be able to enjoy. Make sure you all are asking a lot of questions. It's a great major, to be a part of right now. So we're going to have Nicole Gravitt. She's going to come and give you some information about the School of Public Health, and please ask a lot of questions. There's some things I needed to learn, epidemiology and, what's the different, concentrations of public health. So I'll be learning as well, okay? All right, so thank you. There you go, Nicole Gravitt. Have at it.
All right, thank you. So I'm excited to be here and talk to you guys. Like Ronald said, my name's Nicole Gravitt. I'm the undergrad program manager for the School of Public Health. I have been in this role for almost 10 years. So we are approaching the almost 10-year anniversary for the undergrad program. So that's really exciting that it's been here for almost a decade. Before that, just to give you a little bit of background, public health had traditionally been master level programs. And even at some schools, where you have like biology and English and history and nursing, all of your kind of standard that we think of like standard, majors and programs. A lot of places, public health does not even exist for undergrad. So it's a special and kind of unique program to get to have. And I've worked with it since day one. Prior to coming into this role, I worked with biology and physics majors. So I've been around campus for a while. I think it's a great major for students who have an interest in health. This is not the area that teaches someone, how to be a healthcare provider, but that health emphasis really gives, that connection and kind of a broad, kind of like almost like a toolbox, a resource to take this knowledge and look at health factors. It's like social behavioral determinants of health. It could be environmental factors. It could be anything, I kind of say truly anything and everything around us that has an impact on health and well-being. Health behaviors. There's a whole area like department for, occupational health and safety, but even into the health policy organization. So it is very broad. I'm going to share my screen. So give me just a second, making sure I've got the right screen coming up. Okay. All right. So can everybody see the green slide? It's School of Public Health Academic Overview.
Thumbs up.
Okay, perfect. So I'm going to kind of run through this. I have several slides, but because I know we have people coming and going, I'll probably jump around a little bit. And again, I'm guessing if you have questions, you're welcome to ask, or I guess put it in the chat box and I'll try to.
You can put it in the chat box as well.
Perfect.
So either way.
So, let me back up. So this slide, and I'm happy to share this with anybody. So if there's something, again, if you have to leave before the end of the full session, or if there's something you want more, I will have contact information and all of that. I will put that in the chat box in just a minute, but I'm happy to share these slides with anybody. So just know we are always happy to talk with, students, whether it's major, minor, anything that might help you figure out your path. But this kind of gives you more, I would say, like the textbook definition. It's the science and art of preventing disease, prolonging life, promoting physical health through organized community efforts. So that's kind of the textbook definition, but it really, public health is looking to promote and protect the health of all people in community. Very broad, again, very interdisciplinary. You can see all of the different areas over here. Health promotion, research is a big area in public health. I mentioned environmental health, recovery analysis, monitoring, surveillance, preparedness, communication, and so on and so on. Disease prevention and outbreaks. I think we've all kind of lived through that disease prevention and outbreaks in the last several years with COVID. But moving down the list, there's a few, departments. So I mentioned a couple of these, like, environmental health sciences, epidemiology, health behavior, health policy organization, and even biostat. So these are the 5 main areas that fall under the public health umbrella. So these are the departments that we have. We do have a few like centers that are housed within the School of Public Health. So one big area that I know undergrads get really connected with and engaged with is global health. There's a Sparkman Center for Global Health. It's not a department, but it's a great center. So just another resource. They do different classes. They have a grad certificate that actually undergrads can even take part of. And then from the academic side, we have undergrad. I think I was sharing with most of you on here, the undergrad major has been around for almost 10 years. Before that, we had a minor. So before the major rolled out, minor, and even grad level work. So to jump to kind of highlight, we kind of make it easy. We have one major and we have one minor. It's a Bachelor of Science, major is public health. We do have a few different concentrations. So like if you are interested in public health, you're looking for a major, these are the three kind of main areas from the undergrad perspective. I want to make sure that this is set up front. These three areas, so like the global health studies, environmental health sciences, we just call it general public health track. These do not line up with the options at a grad level. So I know many of you, most likely freshmen or sophomore, kind of early on, we may have a mix of classifications here, but if you're early on in the kind of that academic career and you are planning out, and you may just be thinking, I just got to get my major picked first. You may already be thinking through, beyond finishing an undergrad degree. But if you're starting to think through like academic planning long term, as in you're weighing major, minors, even some grad options that may come down the road, I will kind of challenge you to look beyond just the undergrad area. If this is something that sounds interesting, from undergrad, if you compare the undergrad options to the grad options, it escalates. There are 3 and probably 4 times more options and areas to focus on. So undergrad really gives a good, truly just foundation and overview. But I do always want to let sure my students know if they are, you're looking at and seeing this and thinking this is all that public health has to offer academically, this is barely just, skimming the surface. So again, the major, and I'll have a slide that kind of breaks out the classes or some of the hours and breakdown. So students come in, it is a public health major. I always emphasize the concentration. So these options right here, environmental or global or public, the general public health track, these don't change the major. So we are not talking about having a bachelor's degree for environmental health sciences or a bachelor's degree, for global health studies. These just simply help tailor more of the upper level classes that fall within the major. And by default, when we see public health major, if someone changes to public health and that's all they select in BlazerNet when they push that major through, by default, that concentration will be public health. So public health major, public health concentration. And again, these are things where we kind of see students will have a different area, focus, but there's not just one set concentration that lines up to, like, for example, we'll have students who want to go in and they're pre-health, or pre-med, pre-dent, one of those areas. And they'll say, well, which concentration is better? There's really not. The major is going to stay that broader, more general public health. It's just whichever track fits their interest the best is where we're going to want them to go. And sometimes that's simply keeping that public health major, the public health major, public health concentration. The minor, same thing, make it easy. We simply have one minor, public health. We find that the minor typically pairs very well with many other areas. So I know first and foremost, you're trying, want to figure out what your major is going to be. But as you're thinking through academic options, try to narrow it down. And it may be that you find a couple of different areas and you might be able to do one as a major, one as a minor. So we do typically find that the public health minor pairs well with just about any other major across campus. I mean, we have students in the minor who are in more of the arts and sciences. We have students who are in the business area. We have students who are tracking towards nursing and are they able to do the minor before they get to the nursing program, education. And the same thing with the public health major. So we have students who are majoring in public health that are pulling in minors from many other schools and programs across campus. And then the last area here where it talks about accelerated learning opportunities, this is not so much focused on undergrad, like the major minor. This is more just to kind of put a reminder out there that the School of Public Health has, just with many programs or other schools on campus, we do participate with the accelerated learning opportunities from the graduate school. So there are some times where students will go through like an accelerated bachelor's to master's kind of fast track type program where they're still an undergrad, typically between 60 to 90 hours, 36 hours being completed at UAB, but in that 60 to 90 hour range. So junior, senior standing, and have a pretty strong GPA. So normally we're talking between a 3.25 or a 3.5 and up. But this actually allows students to start a grad level program with a Master's of Public Health while they're still an undergrad. And students do not have to be an undergrad major in public health to pursue like an accelerating learning option. So that's another thing too that we're seeing more and more interest growing, where students are being really creative and kind of like maximizing. I kind of think like you're maximizing that undergrad academic experience. So grades are important for that, as well as making progress. But it's usually like if you're a freshman or a sophomore, the only thing you can be doing to really work towards an accelerated learning program is keeping your grades up. You know, as you get to that junior standing, that's where you can really start to act. And we usually get you connected with the grad school at that point. I'm going to move on to the next slide, which should outline, let's see, the major. So everybody should know, even if you don't have a major yet, or if you're still exploring, every bachelor's degree is a minimum of 120 hours. Okay, there's no difference across the board. Minimum to finish a bachelor's degree at UAB is that 120. This will cover kind of that standard, just your core curriculum. That's, again, classes you've already taken for core, things that you're in now, you know, pretty universal. Those will come into like what we're going to require, you know, the same with our students in the major finishing out their core. So those 41 hours. The major as a whole is 45 hours. And that is going to be split between the public health block, as well as those whatever that concentration area is. And so that's kind of split almost half and half. The major specific foundational classes are going to be 24 hours. And then the students will have another 7 classes to hit 21 hours in that concentration area. And that's what's going to make it that 45 hours for the major total. And with electives, so our area, I feel like, is pretty generous with the general electives. As in, if you take the 41 hours from core, then the 45 hours for the major and add that is not going to hit that 120, okay? So our students typically have around 34 hours or so of general elective credit. This is where they can really, I like to say, put kind of like an individual academic plan together. If you like taking classes in art or something along those lines, you have room to do that. If you are planning for minor, and usually students, we're talking like multiple minors, not just one. I mean, there's room to factor multiple minors in and towards these elective hours. If someone is tracking towards a pre-health program, med, dental, PAPT, or so on, this is typically where a lot of those sciences are going to come into play. So the general elective area, that's something that we actually talk with our students about. These hours play just as an important role in the degree completion as what the major hours do. And so this is an area where I really think students can get a kind of an individualized academic path and plan. The major, there's enough structure. I always tell my students, there's enough structure in the major and the degree as a whole, but there's just as much flexibility in terms of it's not such a lockstep program that is heavy on prerequisites. There are a few prerequisites, like with the lower level major courses. Usually students will take like public health, let me see, I may have them on this next screen. So this is kind of outlining the minor, but the classes you see here, PUH 201, which is Intro to Public Health, PUH 202, Intro to Global Health, 204, which is a Social Behavioral Determinants of Health, which is kind of like an intro to health behavior. It's not titled that, but that's kind of what that kind of gives that introduction to health behavior. And then 210, Agent Host Environment, I also call this like a biological basis. So these are the first 4 courses, whether a student is doing a major or minor. We have these listed here under the minor because this is what somebody would start out in. These don't necessarily have to be taken together, but there is that flexibility depending on, how fast someone wanted to jump into the program or the classes, or how comfortable they were about it. They could come in and technically take these 4 courses together. Or we've got students who typically, they may take like 1, see how they like it, or they might take 2 together. So these can kind of be stacked really based on the student, like your individual needs and what you're interested in. And then beyond these 4, so again, this is the starting point, whether it's the minor or the major. We've had students who will start out in the minor and really connect and like the classes so much they quickly change to the major. And so they're already on their way with that. But beyond these 4 courses, students would then need really 2, and we just call it like approved electives. Some of these may come from other public health classes beyond those intro levels. And some of these can even come from, like, we call it non-public health courses from across campus. So again, it's typically in the minor section, this is going to be 18 hours total. So when I said a few minutes ago, the minor, that's pretty standard, I think, for most minors. This one can really pair well with many, many other programs on campus. Now, the minor is set to where it can be completed kind of in an online blended format. These 4 courses are offered fall, spring, and summer. Fall and spring, there's not a lot of flexibility in terms of the scheduling. They're usually offered one set daytime. You don't have a lot of different options with that. But in the summer term, you get the flexibility where these are offered in an online format. And so with that, with the major classes, I'll backtrack for just a second. The 45 hours for the major, this is typically, most of the time, students are completing that in person. So, the major is not really set up currently to be completed as an online option. I know that's a lot of times I'll talk to students and they'll say up front, I really want to take as many classes online, or I want an online program. And then this is one where there's a few courses that can be completed online, but for the most part, this will be covered between fall and spring semesters, kind of more of an in-person. But again, there is that flexibility of kind of creating that path more individually. And these courses that I have here, that we kind of call those lower level major classes, or, with the minor, these are really the gatekeeper courses for, I would say, 98 to 99. I mean, it's the vast majority of the upper level 300, 400 level classes that you have with public health. And so again, if you're at the point of you're exploring some options, always encourage, students to look through the class schedule, look ahead at the 300, the 400 level classes. And this is with any major. That's going to help you kind of see beyond that intro level. Like, what, if I were to go that route, what are some of these classes and some of the options? Do the same thing at public health. Look under the prefixes PUH. You'll see the listing of classes. You can explore through the class schedule. You might not be eligible for that 300 or 400 level class, or it may not be appropriate to take just yet, but you can at least kind of see beyond that intro level. So simply looking through the class schedule is a great way to connect even beyond like talking to an advisor or just like learning about a major or minor. Let's see. Let me check if there's any questions in the chat box first. Oh, and again, feel free if you have a question. Sometimes I run through this really fast. So if you have a question or want me to backtrack on anything, feel free to put that in that chat box. And I'm actually going to jump ahead quite a few slides just to show this. So, I have my contact information right here. We've got Michelle Henry. She's my colleague that works, is phenomenal to work with. We both have kind of our set assigned population within the major and minor. But I say that you are welcome to follow up with me after today's session. You've got Michelle. So Michelle works with last names A through L. I work with the last half of the alphabet, but we work with our students kind of back and forth. And so you are welcome to reach out to either one of us. But I wanted to make sure that everybody had at least the two, like the two advisors, our contact information. And again, what I'll do is, let me put this in the chat. So bear with me just a second while I type this out. And we are in, as you all should be familiar with, we are in the appointment manager. So you are, again, always can access us that way. I'm going to jump slides for just a second and actually jump to our website. We have just another spot, and I will put this link in that. This probably would have been a better idea to put in the chat box for you guys. Under School of Public Health, and if you ever see something referred to as like SOPH, like SOF, that's our short version of saying School of Public Health. If you just uab.edu/SOF, SOPH, under the undergraduate tab, we'll click on advising. And again, we have our information, a little bio about us. Email is hands down the best way to catch us beyond making an appointment. But if you were to call our offices, these are our direct lines. We're typically meeting with students, so it's rare for us to just be able to catch the phone. So typically we'll say, if you ever have a question, email us, send us an email. Just make sure you put the standard stuff, your name, using your UAB email address. That way we connect and communicate. Let us know if you're thinking about major, minor, what your questions are. We're typically fairly good with email, getting back to you and trying to be responsive, versus usually we're playing phone tag, when people are calling, unless you set up a phone meeting. So you have our information here. You can also explore through some of the slides that I had up with the details about the different concentrations. You can pull up curriculum sheets. Let's see if this will open up here. This one, this kind of depends on which this should be the accurate catalog year for, you all here. Front side of this or first page is more of your core curriculum. One thing I will highlight is for the major, you've got your standard core. The only thing that we specify is you do need a biology. Now, when I say that, some people panic because you may be taking bio now and it's maybe the hardest class you've ever gotten through, or you may absolutely love it, but we don't require a specific biology course, as in we have that PUH 210 class, that kind of agent host environment or biological basis course. That one requires a college level biology C or better. So if somebody's coming in and they are pre-med, pre-health, and they need biology 123, that makes the most sense for them when they take that bio 123, make a C or better. Hopefully that meets that prerequisite. If someone is planning for maybe something nursing related or physical therapy, or, they need anatomy, BY 115, that BY 115, it will not count for core curriculum, but it will count as that prerequisite, the checking off the bio needed for the major. Or if let's say a student is neither, they don't need 115, they don't need biology 123, they could absolutely take the biology 101 and 102. So beyond that, for core, 101/102 for the lab or 123, those are those two really biology classes that would count as a prerequisite for us. And we don't have beyond the other, like the second lab science, it doesn't matter really if it's chemistry, astronomy, physical science. We kind of leave that up to the student based on their interest. I will say, though, if you are thinking public health and you have a strong interest in environmental health sciences, typically chemistry is another great class that kind of fills in just the nature of the topics that come through environmental health sciences. A lot of times chemistry can play a role in that. So you've got that on the front page and the back page. This is where it kind of breaks out those 45 hours that I shared. You've got those foundational classes, those lower level courses. And again, we kind of call these foundation just because these are like the gatekeeper classes for most of the things that you'll see down here at majority 300-400 level. All of these are not required. This, as far as the major goes, this is just showing you the differences between those three concentrations. So when I mentioned earlier, there's the kind of the default public health track. That's, again, if somebody picks public health major and that's it, they're going to fall under the public health concentration. This gives the most flexibility, where we just say you students pick and pull from public health electives. And again, there's a pretty broad list that they can kind of tailor down from those options. If someone were to pick more environmental health sciences, this will outline those specific classes that will be needed for that specific concentration. And the same thing with the global health studies. And some of these, like 333, which is a service learning, it's called food, water, air. It's really neat where students are working with community partners locally while they are, earning credit for it. So it's a little more beyond than the classroom, than just sit like a lecture based, showing up and taking notes. So students get really engaged. And we have several service learning classes. But that is actually one that's required under environmental health sciences as well as global health studies. So even between the different concentrations like this, they all fall under public health. And so there's still kind of that connection there. Let's see. Let me close this out. So that is linked straight from the website. And let me go ahead. I'm actually going to backtrack and get this link that I will put in the chat box. I saw a question a moment ago, and let me scroll up to see if I can find it. It was, what's the difference between BMD and public health? And that's a great question. There's really two different areas. BMD, from my understanding, a lot of times students, I know that is very, very heavy science. It's a very rigorous, it's a phenomenal, major and program, but it's really it's hitting those pre-health classes and kind of tailoring to that. Doesn't mean that you have to be pre-health to major in BMD. Public health, though, and there's a connection. We get a lot of students in the public health major who are BMD minors, or vice versa, students in BMD who are public health minors. And so public health is really looking more from that community aspect, going back to, and I'm actually going to jump back to my slides over here with these departments. Let's see, is that still sharing for everybody?
Can you all see that?
I'm making sure that, okay, yes. Perfect, thank you. I normally have my green box around the screen showing that it's shared, but I am not seeing it on my end. So I wanted to make sure I didn't unshare. But these departments here, so I think that would really be kind of the biggest difference is, the variety here is this is not students in the major, and the max we've had probably around 350 majors. We're probably in the upper 200s right now for students enrolled as undergraduate, but it's kind of interesting because it's pretty steady where it's about half of our majors have consistently said they want to go on and be like they're planning for a pre-health type program, professional program. So they're taking public health as the background knowledge with these topics and themes that come from the departments to help them be more, competitive, just be like the awareness of what's going on that's impacting health and well-being, even with injuries. And it could be things from infectious diseases. So obviously, again, we're all tired of COVID, but things that can be spread, from infection, like infections and viral things that could be more like non-infectious. So think about like diabetes or things that might tie into more genetics. So anything from, diseases, injuries, access to health, whatever's impacting that healthcare. Healthcare law gets into it, policy, epidemiology, health behaviors. So when people do things that they know are bad for them and it's going to have a negative impact, but yet they continue to do it. Why do people do things like that? Things like mental health, adolescent health. I mean, it could go on and on. And then even with things like biostatistics, this is really where people are more really math and numbers focused. Lots of research comes out of many of these departments. So I think, there is connections between BMD and public health, but biomedical sciences is truly more focused on biomedical sciences and a very, very heavy focus, science focused. Going back to over here, and I think when I had the curriculum sheet up from the website, I know I mentioned it when we were talking electives, but with us, we kind of say this is a great ground when somebody has that health interest. So keep still drilling in on health. Our program is designed, if you need those additional biologies and organic chemistries and physics, you need those sciences, you have room to pull that in. They're not required as part of the degree necessarily. If you don't need to take organic chemistry or bio 2 or whatever that science is, you don't necessarily have to take those sciences beyond finishing the core 3, the sciences you need for core 3, but it's not so heavy focused on sciences that it's impossible to be successful in. And so I think that's another big difference is when we're talking just one focuses on one particular area. Public health, it is very choppy, but it is not a one size fits all. So I always tell students can really find their kind of public health passion, their public health heart, what's near and dear to them, but then they can take it on to so many different directions. Because again, we have about half of our students in the major who have no desire to be a healthcare provider. They want to get more involved in research. And I'm going to jump back to the screen where I had it here. They want to do more research focus, whether it's community or in a lab. They want to do a lot of our students want to do things in the community. So like more community health focused, kind of community based work. A lot of our students are very, very passionate about like working with many different nonprofit organizations. And some of these, again, you can kind of see and some of these are very repetitive, but, IRB analysts, we've had students go to physical therapy school, PA school, med, dental, optometry, all of, that whole spread. The AMNP, we have had an uptick in the last few years of students majoring in public health or having an interest in public health with the long-term goal of being a nurse, but not going that traditional route. They were wanting to get their bachelor's in a non-nursing field, complete the nursing requirements, the prerequisites along the way, with the goal of doing something like an accelerated master's nurse practitioner program. So again, we've seen an uptick as far as interest in that. Health advisor with PAC Health, there are local organization actually just several blocks from UAB that are more like kind of more in that health behavior. They're working with patients on like what they're doing, and a lot of times working with insurances to kind of like give advice based on whatever the disease or the injury, like what's going on. So really focused on a more health behavior research services consultant. And there's a mixture. Again, this is just showing you a variety. So global health officer. We've had people like do a lot of our students in the past, or it's been common to be, there's a CDC. So, everybody, if you're not familiar with that, Center for Disease Control and Prevention over in Atlanta, we've had quite a few students graduate and do the CDC Public Health Associate program. We've had a lot of our students go on and do like AmeriCorps Vista, Peace Corps. So again, we've got students who pursue the medical kind of health route, who don't have no interest in doing that, but they want to do more research kind of based, whether it's again, community, lab. And then you've got lots of service, working with, various service organizations and things like emergency management consultants. So it's always interesting to see kind of the direction our students go in.
That's one thing. I'm sorry,
Yeah.
I got one question. Students throughout the sessions have been asking this one particular question. What student activities or organizations they can be a part of that relates directly to you all's major? So that's been like one of the number one questions they have been asking.
Well, there's not just any one particular program. I mean, we have had students, anything that's service related, and I say service related, anything, whether it's volunteering or anything that's service related, that's kind of you think of it as public health is working towards kind of getting a message to a target audience. Whatever that target audience might be, it's going to be different for different people and their interest. Again, whatever that message is, it's going to be different. So anything that's service oriented, that's really working to try to get either, a message out or something that might impact, hopefully a positive impact on that particular community. I'm going to take the slide down. I'm going to jump back to our website and I'm going to click under the student involvement. This will give more of a highlight of things that we have within the School of Public Health. Actually, let me go to the home page. It may take me just a second to find this. I feel like we've recently moved some things around. But there is like the Public Health Student Association. That's open to really any student, any student who has an interest, but by default, students who are in the School of Public Health are automatically in that. They can get involved as much as they want to or as little as they want to. But then there's things like Global Health Interest Group. Let's see, go back here. Here we go. So this is where I was talking about that Public Health Student Association. And again, I'll put the link in the chat box.
Okay.
It's always good to have resources and kind of things to go back to. But here's the Global Health Student Interest Group. If somebody's more interested in maternal child health. And so again, you kind of, even from these interest groups, you can see very specific, interest. So, this would be somebody or students who are interested in more global health kind of themes and topics and activities. Maternal and child health, which is SAGE. This is for, students who are really interested in more of that maternal child health. That kind of falls from the health policy organization. Rural health, this is something where, again, I hear a lot of students who truly have like an interest in more about making sure people have access to the things they need that impact their health and wellness. And then mental health ambassadors. This has kind of really developed over the last few years. I know they have a strong presence across campus. And again, you'll see different things sometimes in the e-reporter or the green mail, maybe some tabling in various events from these. But again, these are just organizations that are kind of housed more through, in the School of Public Health, but are not limited to only public health students by any means. But again, students across campus, our students in our major tend to get, involved across campus in various organizations. Service, again, anything service related. We've had a lot of students who have done work in like volunteering with Blazer Kitchen. A lot of students have, and when I say kind of volunteering, and I like to, this is not from the School of Public Health, but I like to go to the Service Learning website because we use this a lot in advising, talking to students, and kind of just knowing that it's a resource. But under the resources, under Service Learning, there is, let me backtrack just a second, community partners. And I use this with my freshmen all the way up to my seniors. So I'll use this site when I'm talking to freshmen about just exploring, and not to say that this is meaning like to get involved in everything, but just to find different organizations. And most of these are going to be not so much student organizations on campus, but like organizations around the community or even on UAB's campus. But students can kind of go through and just about every single one of these topics can tie it back to public health and like a public health interest. So if someone was really focused on more like maybe like food insecurity, you can click on that. this gives some great places for volunteering, shadowing, internship. So again, from the freshman year and kind of sophomore early on, we'll use this to just help students explore and kind of help them tailor that way. As we get closer to like the junior, senior year, and students are at the end of maybe they're really looking for an internship, or they're starting to think about that first job kind of search and like how to kind of work up their resume and just find relevant experiences for that. We come back to this for many different reasons. And so I really like this page here. Again, it's not from the School of Public Health website. It's completely through Office of Service Learning and Undergrad Research. But this is a great way to help explore kind of beyond the classroom, beyond. So I like to say, I think being a successful college student in any major is the class portion is the easy part of it. Now, the classes may not be easy, but following a checklist or following GPS, it's pretty much telling you what to take and your options. It's the out of class experiences that play just as an important role. And again, this is true with any major or minor, where you really have to think about it. Your advisor can say, you need another core 2 class. Here's your options. You need this major class. You need this class for area 4. Pick this history. But when we start to say, okay, what do you want to get involved in? What are you passionate about? What's going to be relevant for you in your academic and career goals as you are still trying to figure all of that out? This, I think, is a phenomenal resource. And again, you could apply to any major, really any major. But again, from a public health perspective, I'll tell students and I'll do an activity with freshmen and say, okay, look at this and pick your top 3 areas that really jump out at you. And then from that, click on those and try to start identifying some places and explore some organizations that are doing work. And that, again, it's like a win-win. Students are able to connect with relevant experiences and places they may go and shadow. And again, down the road, it may lead to an internship opportunity. It might lead to a job, like something that you do over the summer. So again, I think that's really helpful too.
Thank you.
Yeah, absolutely. Let me jump back over here. I wanted to pick back up and see, I know I've been all over the place, but I wanted to pick back up. Everything connects. I mean, everything from classes you're taking now, whether it's your first semester, everything is going to play a role in your academic experience. And so when we start talking about major versus minor versus grad option versus, comparing programs, you want to learn as much as you can about those. You never want to pick your major based on the title. So even if all you knew public health and you did not, you didn't really know what classes, and you're looking at these thinking, hey, that sounds really neat. Or, well, I thought public health sounded neat until I saw these courses here. Always look at curriculum sheets, whether it's major or minor, or GPS. You have your GPS outline where you can do what if scenarios. That's a phenomenal way to play around. And I always tell mine, you can't mess anything up in GPS. So run as many what if scenarios and combinations as you can. I've mentioned I think I highlighted that 333, that food, water, air kind of service learning class. With campus involvement. So Ron, you ask about kind of some involvement opportunities. Study away. So our students, again, this is not specific to public health, but our students typically are interested in study away. They have they like, just I think with any other area, they want to get engaged away from campus. And so we actually have a few opportunities through the School of Public Health that are, again, these are open, they're not limited to only majors, but naturally our students are interested. But we have had a population health course that has run over the last few years. It took a pause during COVID, but they have gone to Panama. They've gone to the United Kingdom. One year they did a deep South kind of loop. They didn't leave the country. They really didn't even leave the South, but they did a public health through Mississippi down to Louisiana, back around, ended their trip at the CDC and kind of came back home, Birmingham. And this next year, I believe they're looking at trying to change it up a little bit and do something else versus the UK trip. I know they've gone to UK a few times. They did the Panama trip one year. And so, I know in the next year, they're trying to look at a different opportunity to travel. We also have a summer course, and that is under Global Health Studies. So it's under GHS 430, but it is a kind of like I say it's like a summer camp for global health training. I don't know if anybody's familiar, heard of CFAT, the CFAT Training Center. It's in Lineville, Alabama. But that is a class that students do, and they are there for the May mini term for really about 10 days, about 2 weeks or so. And it is truly I think from what I've heard, students like a phenomenal experience. They are looking, it's as close to being in a global type village setting without even leaving the state, and so it's very phenomenal. Students typically earn about 6 credit hours for that experience, but they are truly, it's like a summer camp. They are there staying on site. It is a messy trip where, they are doing like water filtration, fuel efficient stoves. They bring in, the training center brings in people from all over the world to lead sessions. So, it is really a very cultural, kind of eye-opening, just phenomenal experience. So there's always opportunities with study away, which typically, be sophomore or higher. And then with undergrad research, we have students who are very interested in research. A lot of our students are actually doing research in areas across campus that are not necessarily within the School of Public Health. And so we have students who are doing research through medicine. I've had people work through with people in dentistry. I had a student years ago who wanted to be an occupational therapist. She was able to make some connections and kind of created this directed study kind of research experience for credit, looking at disabilities and public health and disabilities. And so that was really a win-win. And I say that kind of falls under that research kind of service learning research area. So all in all, students are really able to, and I truly think, tailor that long-term academic plan from classes to the involvement piece, which again, I think I said it, this truly plays just as much of a role in career, long-term planning as what you're taking in the classroom. This is the area though, that it's a little bit harder because you have to decide what is relevant, what makes the most sense for you, what's going to help you get engaged. This will show you just a breakdown. I know this may be a little small depending on the screen, but this is from First Destination Survey. So you all, as you track towards graduation, when you get to that semester and you're finally, ready to graduate, you're at graduation, the Career Center typically will send out we call it First Destination Survey. This is capturing kind of the data from, for public health students. And this is from, with the bachelor's degree. But from this, 60% of our students were either already are employed. 30% were either further, kind of continuing on with education. So a lot of our students will continue on with the graduate degree. It is rare, and I think it's just the nature of public health, which I think is a very important statement to hear. It's rare for our students to do their bachelor's degree and say, I just plan on stopping at a bachelor's degree. Now, many will stop with, they finish their degree and they want to work for a little bit naturally, but most of them will say, I want to go back. I have plans of going back to do most of the time it's a master's of public health or again, like a professional program. But we have had students graduate with the bachelor's and go almost do like a 180 flip and decide they wanted to do something in education and do like a master's there. Or a lot of times we'll hear things from like business. So it's truly, I say it often, it is not a one size fits all area. Students can really kind of tailor that path. We do have students who want to, do like more volunteering. So I think I mentioned like Peace Corps, AmeriCorps Vista. That CDC Public Health Associate program, that's not really considered volunteer. It's a paid position, but it's more of a service kind of, usually students do it for maybe like a year or two. I think it's a 2-year commitment actually, but I think that would be safe to fall in that service area. And then you've got about 6% that are still not really sure what they're wanting to do. And then sometimes students are doing like an internship or fellowship right there at the end. So I thought that was kind of if you like data, if you like numbers and things, a neat little graph to kind of show that our students are really successful moving into other, the next chapter of their life. It looks very different for, the students who are graduating. I shared that. I'll jump back, I just skipped over this one earlier, but these are some common themes that I feel like we hear very, very often when we are talking to students, whether they are currently in the major, they're exploring, we just hear this, but usually students will say the number one is, I'm just interested in health. I want to do something health related. They don't know what they want to do, but they just want to do something health related. So that's kind of their area of passion. And again, that may mean that you want to be that healthcare provider, or it might mean that you want to do something that's research focused, that's tying into health factors. Or maybe it's something for more law or policy. So that this health does not mean the same thing. Okay. And then usually students will say they want to make a difference in their community. A lot of times students will find that they're really their public health voice, and it's based on past experiences, or it's based on kind of something that's near and dear to their heart. which is why I think there's always a lot of time from that rural, we'll have students who will come from maybe a more rural health or a rural area. And so they have that kind of rural health interest. But they see a difference that they can make back in their hometown or back with a specific target population. Usually students in this area, they are interested in multiple academic areas. So they're not just coming in and only focusing on public health, which I mentioned earlier, between majors and minors. And I think I said it's very, very common for our majors to have multiple minors. They don't have to have a minor at all for the major, but a lot of times just with how their hours line up, they'll end up doing multiple minors just because they have many areas that they can connect with. Public health has a good segue into, again, I think I said earlier, but like the natural sciences, the social sciences, the business side of things, the education side of things, from a community standpoint. So it really, really kind of expands, just about the spread of, all the schools and programs on campus. So they're very problem solvers by nature. So they'll see a problem and they try to think, how can we try to fix that? What can we do to try to prevent that from happening? Prevention is really one of the big, big keys and ideas in public health. I mentioned, or I said a moment ago, most of our students they'll tell us they have longer goals or bigger goals than just finishing. They don't want to just stop at the bachelor's degree. They want to continue and do something else, even if they take a break for a little bit to work. So usually they're thinking beyond undergrad level. And then they don't always recognize public health as the first option. This is, I feel like, probably the most truest statement other than the very first one here. So many students will tell me, and it's probably as close to 10 out of 10 students as, it's not every single one, but it's almost as close to 10 out of 10 as it can be. But will tell me when they find public health, some of them stumble upon it just by accident. They might have a roommate taking a class or in the major. They typically will say, I wished I would have started this sooner. And so we get a lot of students who will feed into the program and just absolutely love it. So let's see. I'll throw this back up here just for contact name and contact. Any questions? I don't know if I've seen any more come through.
Yeah. Any questions? Anybody got any questions?
A lot. I know we've had people kind of coming and going, so I have no idea who's been here the whole time, who came in at what point, but I can recap over anything. I can sit and talk all day for major planning, minor planning. I love one of my passions I have found working at UAB is just truly helping students find the best fit major and minor, just academic path. And so this is something that I love. I appreciate the major discovery fair because it really serves such a great purpose. And I'm happy to go back over. I can start from the beginning. I can take questions. I know registration is coming up soon. And so one thing I'll say are, if you're on the verge of you're trying to narrow major down or you feel like you're pretty close, if you have room, like if your advisor says, we've got these classes that identify, but maybe, take something for general elective credit, taking a class like an intro class. So like if you're thinking public health, PUH 201 is a phenomenal class just to take. And we have freshmen who will take that like the second semester. So even though it's a 200 level class, we have freshmen. A lot of times our students will take, like if they're majoring in public health, usually they don't come in and take a public health class. They can, but most of them will focus more on core their first semester and then going into the second semester. They're still focusing on mostly core, but a lot of times they will take that first kind of intro to public health class. 202, let me see if I can backtrack to where I have those few classes listed. 202 is intro to global health. This one is actually one of the classes in your area for social behavioral sciences. So it's there with like the psychologists. Yeah. So I always kind of point that out too, because sometimes students, if you feel like I'm not ready to take a major class yet, you could take it as a core, an area for social behavioral science as an option.
I just learned something. Thank you.
Yeah, it's kind of hidden in there. I think, mostly with the area 4, it's going to be your histories and psychologies and anthropology, those types of things. So this one kind of gets hidden in there. But 202, that is the one that is also an area 4, core area 4 social behavioral science elective.
I was going to ask a question. I think you kind of touched on it, though. Like, what is the biggest challenges for students in this major? Is it just them not knowing what direction they want to go in as far as what concentration to use in public health? But yeah, what are the biggest challenges?
So biggest challenge, it's not so much the concentration, but what you hit on, like not knowing what to do. It is so broad. And I say it's broad, it's not a bad thing, but students really have to start thinking about, it's one thing to say, this is the best fit major, I feel connected to it, I want to major in this or minor and focus on it. But then the hard part is, what do you want to do with it? Because students can go in so many different directions. And I compare it to like nursing and education. So everybody knows, you're familiar with what nurses do. It's a huge, very important role, just the same as teachers, very important role, but it's very clear cut. Like if somebody does like a teaching degree, there's really no question what they are going to do when they graduate. They may not know what school or what grade. Same thing with nursing. There's not really a question of what they're doing. They may not know what floor or what hospital or what department. Public health, which many other areas, so it's not just public health, but most things across campus, most majors are not that clear cut. Nursing and education are easy in terms of what you're planning for.
Right.
Well, I think that is truly, I think the biggest challenge is what do I really want to do with this? Because if they want to go, if they're tracking towards like a graduate program, that's kind of a little more straightforward, but they're still having to decide what that career path is. And so because it is not going back to this even here, and this doesn't break it out based on field, but even over here where it's kind of jumbled in the word cloud, it's all over the place. And this is just with a handful of students. And so I think hands down, that is the hardest part we tell students it's once you make the decision on the major, that's kind of the easy part. Now it's really thinking through, why did you pick the major? What do you want to do with it? Because that's very, very individually tailored. And we'll tell students, you don't have to know up front. As long as you are connected with the classes and you're thriving in the courses when you start taking those and use something you enjoy, as long as you're doing that and you're reflecting on it, that why will come in place naturally. But we don't want you to get to that senior year, that graduation semester, and you still don't know what. Yeah. So I think that's definitely the hardest. And I say that we have students who come in as freshmen. We have a lot of students who will, through changes, they'll come in sophomore, junior, sometimes even late junior, early, even senior year. And that's when it gets really hard. They're so ready to graduate, but yet they're having to kind of do some back work to make things relevant and kind of see where they're wanting to go with it.
Okay. You all have any questions? I need to get some questions from you all. We've been talking the whole time, so this major is for you all. So please ask any questions you have. Anybody major in public health? Let me see by show of hands. Anybody?
Is anybody this your first time hearing about public health? Like when you saw the options, I know I can see just a few. So like I saw at least one hand go up. But yeah, I mean, that's most of the time students will tell us is I didn't realize this was an option, or I wished I would have done it. Is anybody, if you think back, again, I don't know the spread of the students, but if anybody more recent, I guess from high school, were involved in HOSA, or your school had a HOSA chapter, that health science, usually there's some type of, some students are more familiar with public health, and it's really barely skimming the surface. But I know sometimes public health is kind of introduced, and sometimes even with public health, it's more like epidemiology. But sometimes students will come in with a little bit of a background. They kind of know, but they don't really know. So again, if you're thinking like, I've never heard of this before, you've not missed anything. It's not as out there, as in it's not a subject that you typically have taken in high school, or sometimes this is the first time you are hearing or seeing about it. So very, very common, going back to the theme that I had, is a lot of times students they don't recognize, or they don't know public health is an option. Yeah.
So a lot of you all who are taking your US class, y'all remember this sheet right here? Can y'all see it? The major interview sheet. It's part of one of your assignments. So if I can get one of you all to just at least ask one question from that sheet, that'll help us out and help you out as well.
And you can type it in the box.
Yeah, you can put it in the chat too. If you're shy, you can put it in the chat. Anybody. And if you can, cut your cameras on. I know it's a couple I got emails from, but let's get those cameras on. Let's see if we got a question coming in the chat. Nope. I look like somebody trying to type a question. Let's see. All right. Let's get a question. All right, here we go. One question.
Right.
Okay.
Can you go into PA school with public health theory? Yeah, absolutely.
Yeah.
That's another area. I think I said earlier, going back, I'm sorry, I'm visual, so I'm balancing two screens to show, but PA is somewhere in here. And I know it's mentioned a few times. I mentioned that AMNP, that accelerated master's, nurse practitioner. We've seen an uptick in that. PA is another area over the last several years. That we have heard students who just a big interest in it. I think overall, so not just with public health, but absolutely we have. And let me even, I'm going to jump back to our website. We actually have several coordinated degrees. Now, this is at the graduate level. So sometimes when I always make students say this is down the road, but there are actually several coordinated degrees that PA is one of those. And these are all kind of jumbled together. So you kind of have to look, but it is, let's see, right here. This is an example of, let me zoom in just a tad bit. This is an example where, like, if somebody wanted to go to PA, so you're pre-PA, pre-health, you're taking all, again, the biologies, those specific classes you need for PA along the way. You can't go straight to PA school without a major undergrad degree. So it doesn't matter what you major in. And that's pretty true with any of those pre-health programs. But you're tracking towards PA. You could be a public health major, pre-PA, take your major classes, factor the PA classes in. But even to show you that connection, it's one thing for me to say, like, yes, you can go to PA school, you can go to this school or that with public health. But I think it's another thing to show you where you even have more formal degrees at that next level. And so this is an area where, now this doesn't mean that you would have to do a coordinated degree, but just to show you where you absolutely, public health and that PA program meets. There's programs where, and again, this is all from the master side of it, but just showing the nature of public health and kind of that umbrella connecting. But you've got social work in public health, pharmacy in public health, veterinary medicine and public health. UAB doesn't have a pharmacy school or a veterinary medicine school. So that's even connecting you with, this is connecting with, programs even at different universities at that grad level. Public health and medicine, where it's like MD, MPH, law. We've had students who have gone from, had a great student years ago, undergrad public health major, long-term goal was law school, very involved in like the pre-law association. She went to Sanford, started law school there. She came back and did that MPH JD and is practicing looking like a public health lawyer, if you will, now. So you can kind of see, I think this is really neat to see that connection beyond simply just being told, like, yeah, you can certainly make those connections there. And a lot of times students don't know. I know I would not have known to look that far out to kind of explore opportunities. And so when I say explore majors, minors, grad options, you want to explore everything. Like, you want to maximize your search efforts now so that you do see those. You don't want to be one day, like years down the road, and think, oh, well, I'm just now learning this was an option and I wish I had known about it, years ago, so I could plan better for it. So yes, if you're still on here who asked the question about, I'm seeing questions come in now. So yes, PA,
yeah, it's
the same with
bunch of them.
Any of a lot of those pre-health programs. Public health and social work, that's another really good question. It's the same thing. Social work is very specific to, and there's similarities. That's the hard part too. There are similarities. So social work, that's kind of more of a professional. You can route through that from that undergrad program. And I don't want to misspeak on the social work program, but it's more specific, think like social services. And again, it's hitting a specific need. There are things that's happening in social work though that tie into public health, and so it's public health is kind of, think of it more of that. It could be like that umbrella association organization. And so you've got more from the research side, you've got the environmental health sciences. I'm going to jump back here. And I'm sorry, if you've seen this a few times, but I think just to have it up as that visual, these are like those underlying factors that are kind of pushing through with public health. And so I think public health is probably a little bit broader. I think public health is a little bit broader, but naturally there is that we've had students with that interest of public health with social work. And that's like in the example of, obviously nursing is very different in terms of like that set, kind of hands-on, public health, or healthcare provider, where you've got public health. There's many things that nurses are doing on a day-to-day basis that come from public health research and public health policies. And so it really does connect to many different areas. Let's see.
We got, is public health a good background degree for someone who works and has an associate's degree in respiratory care?
Yeah, that's the thing too. There's not anything specific in the major that hits and ties into specific respiratory care. But if you have that background, you have that associate degree, and depending on what your long-term, what you're wanting to do with that, you can think about it from, and this is just adding, because I know we hit on more of major, minor, grad options. So kind of starting with the bachelor's degree up, but you could take that a step backwards and say, well, I have an associate degree already. So then on top of that, whatever I do with my major, and maybe you do a minor or not, and depending on how far you want to go with it or what you want to do with it. So it could absolutely make a connection, but I'm not, and I'm never going to tell a student this is your one and only option, because in most of the time there is not just one and only options. There's a lot of options from point A to point B. So I think it could absolutely be a fit if you have an interest, again, kind of going back to more of the, health, well-being, but probably, and that could be a great follow-up conversation. So you're welcome to reach out to either myself or Michelle Henry. And if you came in later, we have our information. I'll put it back on the screen over here.
All right. Someone asked a question: what kind of internships does UAB offer for this major?
So we don't offer, UAB, doesn't necessarily offer, we don't do any type of placement. So, there's not just specific internships through, the university. And there are students who have interned across campus. And we've had students intern with, and I guess you would say like an intern, but work more hands-on through Blazer Kitchen. So that's kind of right here on campus. But a lot of hours, sorry, I keep jumping around. But going back to, and I may have closed it out, going back to that service learning site under those community partners. Let me get this page up. And so going through these, we've had students, this is where a lot of these things under here, and again, there's a lot, was where we've had a lot of students do internships. I had a student do an internship, which is not on here, but this summer with Benjamin Moore.
Oh, okay.
Again, so this is where you get, she was more interested in more of health, environmental health sciences. One of the areas under that kind of looks at worker health and safety. We've had students do work with Honda, Mercedes, the plant. So those are areas where people would not really connect with thinking public health. So really outside of the box thinking. Had a student do an internship though with Benjamin Moore from, think about the chemicals and what their workers. So it's more of a worker health and safety. So I don't know that I said it earlier, but public health really hits on, we say where people live, work, and play.
Right.
So it's very, very broad.
They just had something here a couple of years ago in certain neighborhoods in Birmingham, where plants and stuff were located. It was a public health issue, and they were seeing where some residents had long-term effects from being exposed to certain chemicals and things like that. So that definitely deals with public health. So it's things to do around here as well. But I'm sorry, I didn't mean
No, that's great. I think that was just literally miles, if that, up the road, or North Birmingham,
North Birmingham, where the old Sloss was. Yep.
Lots of big issues. So that's more from the environmental factors. We've had students do internships with, a lot of them have fallen under this clean, Black Warrior River, Coosa River Keepers. This has been an area where, again, we've had a lot of students interested in those areas. Not that that's what they're wanting to do long-term, but because I shared that service learning course earlier, if you were on here for that, that food, water, air course, they typically are getting exposure to those community partners, which kind of feeds into it from, I'm learning about it in classroom and I'm getting engaged from that class, in the class, kind of experience, but then they pursue that to kind of do internships. Let me see if I can find any other ones that jump out at me specific with internships. Sustainability, and that's another area, again, it kind of pulls more from the environmental health sciences. We've had students actually intern with UAB in sustainability. So I guess if the question was geared more towards opportunities on campus, UAB Sustainability, Blazer Kitchen, and there's a few other ones like the 1917 Clinic. There's some that are like either on campus or close to campus, or I don't know if the question was just more like what are some of those internship options? It really, again, not a one size fits all. It's kind of stretched across the board. But this is a great, I mean, somebody could truly come in and click on just about any of these, if not all of these really, and then find organizations that would have, an impact connection back to public health. And let's see. I'm going to actually pull up the website, just kind of have that in the background in case we need to refer back to it for anything. Were there any other questions? Did I miss any? I think I caught the ones that I was able to see.
Very good questions, you all. Those were very good questions.
And I'm going to put the page back up under, I'll kind of just click through a few things. So the major in public health, again, breaks out the different 3 concentrations. If you are kind of newer coming in, the 3 different concentrations the concentrations do not change the major. So it's a Bachelor of Science of Public Health. There's the default track concentration is public health. This is going to give the most flexibility. The next concentration, environmental health sciences, and you can kind of see through. And let me go back to the curriculum sheet, because this, I think, does a better job of really highlighting some of those courses. So things like environmental factors, this is kind of like an intro environmental factors course. Worker health, workplace environment, kind of like a worker health and safety, environmental justice and ethics, food, water, air, toxicology. And then, so those are some of the themes that fall under specifically that environmental health science concentration. Again, not the major stays public health. And then the next concentration, or the last concentration for undergrad, would be global health studies. Again, that food, water, air course, you see that in both of these tracks, but that's a requirement under that concentration. Immigrant, migrant, refugee health, global health cases, and then global communicable disease challenges. And actually, I will share, this may look a little bit different than if you were looking at classes in BlazerNet, but just to show you some of the classes, since registration will be here really soon. You've got your intro to public health class, 201. These are all under PUH. The public, under PUH that's the prefix for public health, PUH 202. And this is the one, the 202. This is the one that counts under your area for social behavioral sciences. It's one of those elective options. So when you look in GPS, you'll see that listed there if you have not completed your area for social behavioral science yet. But that's Intro to Global Health. There is 204. This is Social Behavioral Determinants of Health. This is really, I tell my students, it's really like an intro to health behavior. 210, this is the one that had biology as a prerequisite. So again, if you're coming in more recently, you do need a college level biology, a C or better in a college biology for the major. And that's because you need it as a prerequisite for this PUH 210 class, but it does not have to be like a specific number. So 123, if you're on a pre-health track, most students are going to take that. That'll count. If you are not pre-health and you don't need intro biology, you probably don't want to take that if you don't need it. You could take 101 and 102. The 101 is the lecture, 102 is the lab that goes with it. Those would be options for that core area 3. If you are planning on taking anatomy is not a core 3 science, but if you take that, it will absolutely count as a prereq for 210. So again, you need a biology course, but we kind of meet you where you are based on which biology suits your academic needs the best. And then there's 210, which is that kind of an intro environmental factors. And as you scroll through, you'll see sometimes, sometimes there's honors classes. We don't have a whole lot in the spring. In the fall, we typically will have an honors section for 201 and 202. So if anybody's is honors, we normally will have an honors section with the first 2. We usually will offer an biostatistics, an honors section, both fall and spring. Let's see, there's epidemiology, public health practice, public health systems, profession of public health. This is an example. It doesn't highlight the greatest, but this one right here, PUH 399, this is an online special topics course. And even though it's $399, being a special topics, it's open to any student. If you have an interest in the topic is cuisine, culture, public health, I'll click on the description. where you can actually, well, you could see this when you do a search in BlazerNet, you would actually see the comments from the BlazerNet search. But, it takes you a tour through the food industry, its interactions between business cultures, food traditions, and public health. And I won't read the whole thing to you. But again, that's sometimes you'll see classes like that, like a special topics that might be appropriate or that might fit. This one is, again, this was online. You'll notice most of the classes here are in person. The undergrad portion is pretty much your in-person face-to-face. The grad options, you have many options for online. It can be done in person or online. We are in the works for an online undergrad program, but it is still going through approval. And so it's not ready. We're not at the point of rolling it out yet or advertising it yet, but we are kind of it's in the works. We've heard the need for students and kind of that request. And so it is definitely in the works. But right now, you will notice that most of the classes are in person, face-to-face. A few other the classes just to look at managing public health programs, toxicology, global communicable diseases. We have an intro GIS for public health, which is another kind of special topics class. So, again, if you're looking at exploring, maybe you have room for just an elective credit to see if you like something. 201 is a great intro course. It's intro to public health. 202, again, that one counts in the area 4, can count as an area 4 core elective under social behavioral sciences, and that one's intro to global health. So,
all right. Any more questions? You have any more questions? Well,
I think I'll put this our advising page back up just to kind of leave it there.
Right. So yeah, you all can go ahead and take down their information. If you have any further questions, you can definitely reach out to them for any information you need. Well, Ms. Gravitt, thank you. Is Gravitt, right? Am I saying it correctly? All right.
Yeah, I think you were saying it. I think so.
All right. Well, hey, yeah, thank you so much. That was a lot of good information. Hand clap emojis. But thank you so much for all the information you have given us. And I learned something today as well.
If you have more questions, Paige, you have the contact information. And I'm assuming you can get it for BMD as well. And that way you can connect and follow up as needed.
Okay. Yeah. Well, all right. Well, thank you so much. I think that's it. Need anything, let me know. I got your contact information, so we'll stay in touch.
Good. Thank you.
All right. Thank you. Bye-bye.
All right.